So here we are again. I'm Harriet Burgess and I am one of the hosts on the BAMAN podcast, and this is Emma Gray.
Hello.
She is another regional lead for East of Anglia. Me and her share that role. And I'm going to introduce Anna Baker, who is our guest today.
Hello. Thank you for having me.
And really what we're trying to get out of this episode is for so many aesthetic nurses, this is sort of a conversation they have with each other. But are you a specialist niche kind of nurse, or do you adopt more of a holistic approach when looking after your patients?
So Harriet, how would you define specialisation versus the holistic approach to a patient?
Yeah, that's a good question, Emma. So I would probably say for those in the industry that are niche, my understanding would be that they would really specialise on one specific topic or for one specific treatment. For example, I know that some nurses will only deliver laser.
Yeah.
Whereas other people only focus on facial treatments. Whereas the holistic, I'd say a holistic approach is more, I'd say actually we all probably do that, even though we're probably actually like almost semi-niche in what we as a 3 deliver.
Offer, yeah.
But I would say holistic practice is more about nurses, doctors, dentists, whoever it may be. They offer a realm of treatments, and that, I suppose the best way to explain it is
body,
example. Maybe? I would say maybe like, say you came to me and you were 55 and you were menopausal.
Yeah.
You hadn't seen your GP. You had come to me with a full face of acne. Really what I'd be thinking as a nurse is, okay, well, we need to manage your menopause because it's currently unmanaged. And we also need to manage your skin, because for you as a patient, you'd be coming to me saying, I want my skin to be clear. Yeah. So it's about educating that person to say, actually, this could be related to your hormones. So I personally wouldn't be, that's not within my scope of practice to manage that. I know there's a number of nurses within BAMAN that do, but I would then be referring that patient out to have their hormones managed. Yeah. And actually I might write them a treatment plan for their skin, get them on some really good at-home skincare, and then wait and liaise with that nurse who's dealing with the hormones, and then come back to me for skin. Vice versa, that person that has that holistic practice potentially could do all of it under one roof.
Yeah.
So I'll be controversial and say, I think really you can do both.
Oh, I like that.
I think like you could do both.
Yeah.
And I think in many ways, I think it's quite challenging now, because the plus side of the scope of treatments out there for our patients is that there are so many options.
So big.
Right? It's massive. But then that forces us into a very critical space of being really careful and cautious in terms of what we could or couldn't choose to bring on board, aligning to what are we focusing on,
Yeah.
And I think it kind of comes down to knowing your community and your collective patient group inside out, back to front. Because I don't doubt that there are different niches and different demands in different areas of the country.
100%,
yeah.
And I think somehow we try and find an alignment between that and also pursuing treatments that we enjoy with an evidence base that meet those needs, and trying in some ways to find the balance of bridging the two, which means that that should be holistic, whether that's a treatment offering of toxin and filler, never mind skin, which is where our sector really started, with peels as well. But in essence, it was pretty rudimentary in terms of what I feel the sort of non-surgical medical sector started with, into now what's exploded, which has gone from almost one extreme to another. But my point being that I feel you can be both. And successful clinics, I would say, or successful medical aesthetic nurses are the ones that cater to those needs of that patient group with carefully selected treatment offerings, and get really, really, really good at them by knowing their patient group.
Yeah, it's
really,
that
really
in-depth assessment,
absolutely,
isn't it? It's finding potentially what you think is a possible cause. And if you are not treating or have the ability to treat that cause, it's then referring those patients out.
Absolutely.
Whilst keeping that interest of what you're doing, and still sort of often working together. Writing those letters of referral, explaining what your treatment plan is and whether that's cohesive to what they would advise.
And I think there's a lot to be said for referring.
Yes.
Absolutely.
We're aesthetic injectors, we're aesthetic medicine nurses, and the scope is massive for what we can offer nowadays in clinic. But we're not specialists in everything.
No.
And we need to draw on our colleagues' knowledge to keep our patients safe.
100%.
And I think
it's working within your scope, isn't it?
Yes,
exactly. And not be afraid to refer.
Yeah.
Not be afraid to say, do you know what? I think we could do this and this, but do you know what I think would be better is if we get a second opinion and we speak to this dermatologist. I mean, I don't do mole removal or anything like that because that's not my speciality. I've never worked in dermatology. I don't want to start taking people's moles off. Anna, you've worked in dermatology. You've got a specialism there. My clinic is very focused on injectables and to a certain extent skin health, but only surface level. I don't have any lasers or anything to treat. So I'm very niche, whereas Anna, you've got a whole host of lasers. Skin is your thing, isn't it?
Do you know what? My practice has evolved and changed hugely in terms of my treatment offering, and I built the core experience of my skill set on solely doing toxin and filler. And laser.
I think a lot of people have done that to introduce
different.
themselves to the
it's true.
speciality, though.
It's true.
Yeah.
It's probably not dissimilar, as you say, to how many medical practitioners alike have begun their journey and their career ultimately. And we expanded our offering on the basis of enhanced offerings in terms of the quality and the technology and the sophistication of devices, and ultimately the price tag, of course, accordingly increasing. Yeah. But ultimately the technology has really caught up with the demand in terms of many lunchtime approaches, minimal downtime with a lot of energy-based modalities. But again, they have their place, and that's not to say that a successful practice is built on offering everything, because there's a very different level of risk, price tag, and insurance level with bringing those types of treatments on board. But in essence, we developed into that offering on the basis of the type of skin concerns that we see in our demographic in West Sussex. We treat levels of photo damage that I've never seen before. And the bulk of my day-to-day practice is basic education about vitamin D, about sunscreen, about getting the balance right between healthy sun exposure and not being reckless, can I say, being vigilant about what to look for changes in certain areas in the skin lesions, etc. Basic things really, but the education is still really needed. But ultimately, to treat the type of photo damage that we see and treat, we need that sort of level of equipment in our arsenal to be able to give that offering to our demographic. And therefore, that has kind of been a bit of a self-fulfilling prophecy, because then it kind of spurs an interest, a level, a practice need to then develop, to undertake further training.
When you start that kind of career path, you start to then learn them trends, don't you, from where you live and who your clientele are, or your client base.
And look, I mean, to be devil's advocate, let's say perhaps if I was working in a different area of the country, I may not see that, but the bulk of what our patients want and need that I see, yes, injectables, I'd say bread and butter, absolutely, do a lot of injecting, but it's mirrored very closely statistically when we look at our audits by the number of energy-based treatments that we do that partner with those for skin as
like
well.
A sandwich.
Absolutely. But that's our offering and knowing our community. It will be different for all nurses.
My journey was, obviously I started injectables, and then you very, very quickly realise that people are coming to you with skin complaints while they're having their injectables done. So then I was like, okay, I need to take on a skincare range. So then I started getting into skin, and then you're going down the chemical peels route. Then I developed into microneedling. And then from that, there's only so much you can do with that.
I think once you've also mastered those skills and found what you have enjoyed, it's then picking what you're collaborating with. And what I mean by that is the brands that you choose to use. And I think, we are very aware that the UK market is completely unregulated. So there are a number of products out there that are just not even FDA approved, or, you wouldn't inject into your animal, really.
And it's scary, really, because patients don't have that level of awareness that we do. And I think that's where it's important to be an advocate for your patients. And
by doing your research.
Exactly, by doing your research.
100%.
And when my patients come in, I mean, they've had treatments elsewhere, and I say, what filler did you have? And they're like, I don't know. Right now, there's not enough data and there's not enough history of these products that are being given. And I think that's one of the important things when you do think about being like a niche practitioner or holistic with loads of different components to your clinic, is don't jump on trends too quickly, because often they don't have don't have the data and stuff behind it, and it hasn't been out long enough. And I think if you're introducing something new to your clinic every 6 months, your patients are going to watch this and be like, oh, well, she was offering this the other month, now she doesn't offer that, now she's offering this. So I have a little rule in my head where I like to watch a trend, as I call it, for a good year. And if people are still raving about the results after a year, I will then look into it.
If you have a fantastic machine that has got fantastic evidence behind it, you still might not get the results if the person that is using that machine is not educated to have a good patient selection.
Yeah.
And I think for me, my approach is very much I read.
Yeah.
To the detriment sometimes, because actually evidence-based information, for want of a better word, is often delayed, because by the time they get that evidence published, you're working sort of 10 years behind. So, you know, the way that our speciality grows so quick, I think you have to be a bit of a skeptic for the new stuff that comes on board. You can read about it, but obviously a lot of the data that comes with new products is from the pharmaceutical companies themselves. So they're obviously going to want
wary of that.
Yeah.
And I think that's another reason why it's important to come to the regionals, because then you do find out what specialities people have. So when you are at home in clinic and you've got a patient where you're like, do you know what, my scope stops here, you know who to call. And
absolutely.
you know you can. And this is why with Amy developing kind of like the phone book of specialities in medical aesthetics.
It's invaluable.
It will be invaluable.
But I think it does also reinforce, of course, it's great to know in our membership who's got that expertise, but it reinforces again holistically to build relationships almost outside.
Far and wide.
In terms of menopause.
The goal is the same, isn't it? It's to improve that patient's outcome of why they've attended that day.
And I'm not saying that that's necessarily always the easy thing. Probably some areas of region that's easier than others. Where we are in East Grinstead, we have Mikindo on our doorstep. So we're very fortunate, but I'm fully aware that that is not the case in every. Exactly, absolutely. That's not the case everywhere. And you know, there can be professional boundaries and politics that play with all of these things. But the ideal is to be able to have, you know, that phone book and that access to those specialists when we need them. But ultimately, as we said, you know, this to have the expert initiative and information about what we've got in our membership is superb.